Welcome to the Vitality Vault Podcast, your one-stop shop for health and wellness. Join us as we dive deep into the latest medical trends, break down complex health topics, and empower you to live a more vibrant life.
Hi there. I'm Dr. Bacchus Morris, a triple board certified physician who specializes in internal medicine, obesity medicine, as well as anti-aging, regenerative, and aesthetic medicine.
Hi, I'm Dr. Gerald Morris, and I am a double board certified physician in internal medicine and obesity medicine with special interest in peptide therapeutics, which I got certified in.
Together, we're passionate about helping you achieve optimal health and longevity. From exercise, nutrition, we'll be bringing you the latest cutting edge in terms of weight loss and everything else in the wellness world to help you achieve a healthier you.
So our goal is to help you live your best life. So whether you're looking for weight loss strategies, longevity, just want to live a little bit better, and have these tips that you can apply to your daily life from day one, we are here to help. So come join us on this journey.
Join the doctors, voted top internist in Tucson 4 years running. So let's unlock your potential together. Welcome to the Vitality Vault Podcast with Dr. B and Dr. G.
What is up, fam? Welcome once again to another episode of Vitality Vault with myself, Dr. G, and the lovely Dr. B. There she is.
Hi,
Dr.
guys.
B, how you doing?
I am doing well today, thank you.
I am Homer-tastic today.
Homer-tastic. Okay.
You know why? Because today I am rocking my Homer Simpson socks. No. Today is, you know what? It's fitting that I picked Homer for today's episode.
I think so.
I mean, when you look at Homer Simpson, right? He is the picture of bad health. He is the picture of high cholesterol.
Absolutely.
mean, lard lad donuts. Let's be honest. That's not a food group.
I know.
No, but that's all the guy eats. So today we are discussing high cholesterol, and the aim of today's episode is to kind of give you a high-level view of cholesterol in general and what we do as primary care physicians when we start the journey and the investigation into why someone is dealing or suffering with high cholesterol. We do plan on going deeper.
Absolutely. I was going to say high cholesterol can definitely be a complex topic.
Yes.
There's so many, new things that we learn as we go along.
Big one.
Yeah, because it contributes to so many other health disorders as well, too. So we're going to be kind of like touching the surface, giving you kind of like what you need to know right now. And later on, we'll bring in some
We're going to have to dive deeper. We're going to have to dive deeper into everything with regards to high cholesterol. So let's start off with how do we diagnose this one? So pretty much it's through blood work. Anyone with elevated levels of LDL cholesterol, that's the bad one. Everyone knows about LDL. And even triglycerides too, that's a picture of you not doing well cholesterol-wise. Now, people who tend to have really bad cholesterol, LDL cholesterol, can also have abnormally low HDL cholesterols too, which is a problem. So you want that ratio to be good. Now, some stats for you, Dr. B.
Yes.
Apparently, 38.4 million adults in the U.S.
Actually, yeah, I believe
gosh.
that.
My gosh.
I see it all the time.
Yeah.
Yeah, and it actually says here that less than half of them are aware of it.
Exactly.
So, we might not even be capturing the full amount here.
No.
Because, again, you have to test for it, right, to know that it exists, the high cholesterol. So I'm sure that is that number is definitely lower than what it is.
And what I've seen, I've seen from patients who come to us, like those who come to us for weight loss and whatnot, because we do full spectrum testing, because I need to know what's going on before I prescribe a plan to get people healthy.
Yes.
You find patients who have, I used to call it cheaply elevated cholesterol, where it's high, but it's not so high. So, and I mentioned them, hey, your cholesterol is a little bit high. And I get the response, oh yeah, I've known. But they're so nonchalant about the whole thing. What we look for is basically an LDL less than 100. That's typically what we see, less than 99. And if you have any condition like diabetes or have had a stroke, it needs to be now the new standard, I think, is less than 55 on the LDL.
Yes.
But there are patients who walk around with the LDL of like 122, 133. And they're okay health-wise.
Yeah, I think the big thing is there's also a shift in the types of foods that we're eating. So, like, decades ago, we're walking around with a cholesterol of 130. It actually used to be normal LDL.
LDL, yes, I know, 130.
But they moved it to 100 just because with everything else, or lifestyle factors, etc., that's bringing in more inflammation into the body. On top of that, elevated cholesterol is definitely being detrimental to our body, causing more heart disease and more blood pressure issues, etc. So, the numbers to hit for a healthy cholesterol has definitely changed, and just want to,
For the better, too. I mean, they've gone down, which they should. But I still see people are not as aggressive. They still see it as, well, it's a little bit high, 105, 110 LDL. Yeah, it's above, but I'm okay. No, you're not.
Yeah, and
it's
it does go up with age too.
It does.
So you gotta keep checking, not just check it once in your life. Typically, I tend to do it for my patients like once a year when they come in for their physical. Let's check it. Let's just see where you're at. It doesn't hurt to do it, right? I mean, you'd rather know than just not knowing what's happening in your body.
Now, symptoms of high cholesterol. Typically asymptomatic.
Nothing at all, yeah.
Usually, if you feel your cholesterol, it's because it's gotten to a point where something's blocked and died. So you don't want to ever feel your cholesterol. If it's there and we find it through testing, be aggressive and act on it. And how do we test? Like I mentioned before, through blood work. That's what we have to do.
Okay, let's talk about the risk factors here for cholesterol. So, of course, poor diet, right? You've heard about, eating cholesterol, eating high fats, etc. So you definitely want to decrease your saturated fats and also sugars, because what people don't realize is your excess sugars that you're eating at the end of the day, when you don't burn them off, they're converted into fats and stored as cholesterol. So we don't want that excess sugar rolling around your body. Older age, absolutely. As you get older, your metabolism slows down, so cholesterol levels tend to go up. So we're constantly fighting against that as we get older. Lack of physical activity speaks for itself.
Yeah.
Absolutely.
Oh, yeah.
Which can then lead to obesity. And of course, here we have smoking and alcohol again is a risk factor for most inflammatory conditions. There's definitely a genetic predisposition. But even if there is, just making sure you're eating and doing the right things lifestyle-wise would definitely help to avoid you falling into that category. Definitely, diabetes put you at a higher risk, and if you have high blood pressure as well. Now, we talked a little bit about testing before. We check your lipid profile, which consists of your LDL, which are your bad cholesterol, typically. And those are the low density particles. And your HDL, which is a good one, are the high density particles. It also checks the triglycerides, which can also be elevated in certain cases of high cholesterol. Now, there are some other things, and I mentioned them right here. There's an expanded what's called NMR panel, which is actually a spectroscopy test that basically measures all the different sizes of the lipoprotein particles. And based on the sizes, it actually gives you a risk assessment for cardiovascular disease, like your risk of developing cardiovascular disease later on. There's also newer testing that's become a little bit more popular. It's called apolipoprotein testing. It checks for ApoA, ApoB, ApoE, and it looks at the ratios. These are genetic testing, and some of this can actually reveal some familial types, that's genetic types of high cholesterol. So then we know exactly what we're dealing with, because those familial types, they are harder to get under control than just a regular high cholesterol from not leading a healthy lifestyle.
And with Apo, I think the ratio of ApoB to ApoA is what you're really, really concerned about from a high level view, obviously. The more B you have than A, not good. But they're definitely that testing is one that we use for our patients periodically. I mean, I wouldn't recommend getting that every 3 months, but at least a couple of times, maybe like twice a year or even once a year, depending on your risk factors. You should get that done so you know exactly where your particles fall and be able to adjust lifestyles and management accordingly.
Absolutely. And these other levels of testing typically you come in with where you're having difficulty getting that cholesterol under control, or just just a cholesterol look, like especially if I have someone that has really high LDL along with a really high HDL,
yes.
then it might be a genetic component. We may need to do that genetic testing. So it all depends on where you fit in that spectrum, and what whether we need to go a little bit further to see what's going on. You have a lot of family members that had heart disease. Maybe we want to evaluate some of those particle sizes and see where you sit as well too. So it's all individual, based.
And of course, you want to monitor liver function, because fatty liver disease is also something that's on the rise. And that's primarily because of the excess fat and cholesterol flowing around in your system. It puts pressure on the liver. And did you know that fatty liver disease is now becoming one of the most common causes for liver transplants in the U.S.?
It's crazy.
It's ridiculous. We're seeing liver failure because of cheeseburgers. That is insane to me, especially when it's something that is lifestyle change. Lifestyle change.
It's crazy because most liver failure before used to be due to alcohol use. That was the biggest cause of liver failure. Now you're probably seeing the term NASH.
NASH, yeah.
Non-alcoholic.
Steatohepatitis.
Liver disease, basically. That's not alcohol related. So, that's what we're seeing on the rise now. And that's all related to lifestyle. Unfortunately.
It's bad. Let's go straight up. Lifestyle modifications. We've been through this before. Get active, eat more fiber, discuss your weight management with your qualified healthcare professional, get on a smoking cessation plan. And then we sometimes have to use medications. Sometimes we do. And the more everyone knows about statins. Statins are everywhere and they are good drugs, but everything that we prescribe does have side effects. So as you can see here, atorvastatin and rosuvastatin, that's sort of the big ones that we use currently in our practice. Zetia or ezetimibe, that's a bile acid sequestrant. That's a different mechanism of action compared to the statins. And the newer kid on the block is the PCSK9s. I actually really like this class. It is an injectable. And we normally reserve these for those who are more difficult to control cholesterol-wise, or they have had some level of statin allergy or intolerance. We put them on this class of medications, and they do really well to get the cholesterol down, obviously with lifestyle modification in place. We always try to get patients to make the change themselves so we don't have to change them ourselves.
And you can actually use these in combination with each other, these pharmacological drugs. Obviously, you don't want to if you can avoid it. But in cases, especially in some genetic cases, we have the injectables along with a statin, and that helps to get the numbers down, especially if we're dealing with heart disease. We're trying to avoid a heart attack. So we can use them in combination as well. We just got to monitor really well if we're doing that, like monitor liver functions and just making sure it's not causing any havoc in your body. Okay, so let's talk about supplements. How can I help lower cholesterol on my own before getting to those big guns like the statins? So omega fatty 3 acids, we've seen these in a lot of our topics that we've been discussing so far. They definitely help to reduce cholesterol, especially the triglycerides. So this works really well for high triglycerides patients. Berberine is a plant extract. I love it because it helps with lowering cholesterol, specifically LDL, and actually helps with blood sugar levels. So, it's kind of a twofer when you're talking about maybe someone who's diabetic. It helps with both the blood sugars and the high cholesterol that, comes along for free with the diabetes, unfortunately.
But wait, there's more.
Niacin is a B vitamin that has been found to actually increase the good cholesterol and helps to lower the bad cholesterol with its mechanism. So we actually use this in conjunction a lot of times with other medications. Red yeast rice is a plant extract. It actually, the mechanism is similar to a statin. So that's how it helps to lower the cholesterol. It actually can be pretty impressive in lowering cholesterol on its own in some cases.
Now, plant sterols, these are more dietary ones you take to help block cholesterol absorption from the diet. So, and they actually work pretty well, and they are quite well tolerated. Garlic is a good one. Who doesn't love some garlic? If you love Italian food, Mamma mia, you're going to love the garlic, right? So garlic is good, helps lower LDL, and also it's used for blood pressure control.
Now, the amount of garlic, though, would you recommend eating that amount of garlic?
Not if you are Dracula or Nosferatu. I would not. But if you're a regular person, still no. Still no. It's a lot of garlic. So you may want to look into a good garlic supplement and to take that orally, because as we've seen, all the supplements that we talk about that do help, or the food extracts that do help with improving health, if you were to eat those foods, you'd have to eat a monstrous amount of those foods, which may not agree with your system or those living in your ecosystem if it's garlic. So you may want to consider doing something like a garlic supplement along with keeping a good amount of garlic in your food.
Right. And there's this supplement aged garlic that's actually been shown to be like a superfood to actually help with the lowering cholesterol and blood pressure as well too. And yes, the amount of garlic that you actually need for that, you need to pack it in a capsule and not be trying to eat all of that.
Yeah, let's get the extract.
Absolutely.
Get the extract,
for the sake of those around you.
Yes, please. Now, fiber, we know what fiber does, right? It binds cholesterol in your GI tract. So having a good amount of fiber, and typically we recommend patients do, or clients do, anywhere from 20 to 30 grams of fiber a day as part of their diet. That will help to improve even blood sugar control, as well as helping lower overall cholesterol. And who doesn't love some good green tea? And if you don't like green tea, all you need to do is get the extract, which is EGCG. And that's the one that has the antioxidant activity and can help improve cardiovascular health.
Absolutely. Okay.
So this was a quick, short, sweet on high cholesterol. And that was intentional because we wanted to just give you a high-level view so you could begin to do your own reading and research. Look at your blood work. Pick up the old stuff that you had from your recent doctor's visit and look and see where your cholesterol's at and begin to ask the question, am I ideal for my age? Is this okay? Am I just, ignoring it because it's slightly elevated and when I could do the work to get it lower? Because it has only one way to go, and that's up if you do nothing about it. So just be very careful with that. And as with everything that we say, anything we recommend here, talk to your doc, qualified healthcare provider, see if it fits your lifestyle, if it's you based on your health conditions. And if it does, it wouldn't hurt to try.
Hopefully this was very informative for you guys. And as we said, ask questions ask your doctor questions. Don't ignore anything, especially if there's something red flagged on your blood work. You want to look a little bit more into that. But high cholesterol, heart disease, a big one. So if we can do anything to help you avoid that, we're here to help.
Check out our email in the show notes. Send us an email with your comments, or if topics you want us to cover, let us know. We'll be happy to do that. Thank you for watching Vitality Vault. Can't wait to get you guys back in the vault again for another exciting episode.
See you guys later.
Take care.
Thank you for watching and listening to the Vitality Vault with Dr. B and Dr. G. Don't forget to check out our other informative episodes as the doctors dive deep into your health and wellness so you can live a more vibrant life.